So there's so many specialties within OBGYN. I'm a generalist obstetrician and gynecologist, which is really nice because I'm able to do all the obstetrics part of it. So I do prenatal care, I deliver babies, I do both vaginal deliveries and cesarean sections. Then I also do the gynecologic side of things. So if somebody has irregular periods, if they have pelvic pain, if they have any issues gynecologically, I can then help them with that. Not always including surgery, but I do surgeries. I do hysteroscopies and laparoscopies and hysterectomies. But we can also do in-office procedures now. We can do things that are medication-driven that we used to rely on a hysterectomy. Now we can do an endometrial ablation, which is a 90-second procedure to help with irregular bleeding, and it's avoided a major surgery. So it's really nice as a generalist that I can do both obstetrics and gynecology. But if there's something very, very complicated within our system, I have many specialists that I can work with directly. And it's really nice. Like, for instance, we have a specialist in very complicated surgeries. So if I send my patient to her, I still do the surgery with her. So I'm still part of the operation. I'm still part of the care plan. To me, educating patients is really the most important part of my job. I want a patient to come into my office, tell me what's going on, I can evaluate things, do my evaluation, and then sit down with them afterwards and say, this is what's happening, and why. I find like the most rewarding part of my job is actually just meeting patients, learning what's happening, and helping them. So many patients feel that they just go to a doctor's office, they get 15 minutes, and that's all they get. I want a patient to feel that they really feel comfortable with me, that they feel that I'm listening to them and I'm helping them, and that our relationship exists outside of the office.